Hello dear nursing officers. Today we are going to discuss about ESIC nursing officer previous year question and answers part 3. The first question is, the term describes decreased number of platelets. A. Hemophilia, B. Neutropenia, C. Leukopenia, D. Thrombocytopenia. The right answer is answer D. Thrombocytopenia. An abnormal decrease in the number of platelets is called thrombocytopenia. The process of tightening of fibrin clot in the ruptured area of the blood vessel gets smaller, and this decreasing bleeding is called A. Fibrosis, B. synarthrosis, C. fibrinolysis, D. syneresis. The right answer is option D. Syneresis. Syneresis is otherwise called clot retraction, and this is the final phase of healing. Platelets contract and pull the edges of the vessel together. Actin and myosin in platelets contract within 30 to 60 minutes. So, the reduction of the damaged area allows fibroblast, muscle cells and endothelium to complete repairs. Next question is, hypochromic and microcytic RBCs are seen in A. Hemolytic anemia, B. Pernicious anemia, C. Iron deficiency anemia, D. Acute blood loss anemia. The right answer is option C. Iron deficiency anemia. In iron deficiency anemia, the size of RBC decrease less than 7.2 micrometer. So, microcytic. And the amount of hemoglobin in one RBC decrease less than 30 pictogram. So that's why we are called the RBCs in iron deficiency anemia are microcytic and hypochromic. Next question is, a client have not had a bowel movement for 3 days. Which of the following medication may contribute to constipation? A. Folic acid, B. Iron, C. Potassium, D. Vitamin E. The right answer is iron. One of the common side effects of oral iron therapy is constipation. Other side effects are nausea, vomiting, staining of teeth, metallic taste in tongue and black stool. Next question is, which of the following is a bleeding disorder? A. Leukemia, B. Anemia, C. Hemophilia, D. Leukopenia. The right answer is hemophilia. Hemophilia is an inherited sex-linked recessive bleeding disorder, occurs due to the deficiency of clotting factor 8 and 9. Next question is, the purpura is the manifestation of A. Thrombocytopenia, B. Anemia, C. Leukopenia, D. Neutropenia. The right answer is thrombocytopenia. So, what is purpura? Purpura occurs when small blood vessels leak blood under the skin. The purpura measures between 4 to 10 millimeter in diameter. When the purpura spots are less than 4 mm in diameter, then we called it petechiae. Purpura spots are larger than 1 centimeter. They are called ecchymosis. Next question is, apical pulse of heart is normally felt at A. Left 5th intercostal space, B. Left 4th intercostal space, C. Left 3rd intercostal space, D. Left 2nd intercostal space. The right answer is left 5th intercostal space. And this is 5th intercostal space, and we are felting apical pulse here. Next question, normal mean pulmonary artery pressure is A. 10 to 15 mm Hg, 15 to 20 mm Hg, 20 to 25 mm Hg, 25 to 30 mm Hg. The right answer is 20 to 25 mm Hg. Next question, one cardiac cycle completes in 0.8 second, 0.12 second, 0.57 second, 0.9 second. One cardiac cycle is last 0.8 second with an average heartbeat of 72 beats per minute in the adult at rest time. So, one normal cardiac cycle lasts around 0.8 seconds. Next question is, the difference between systolic and diastolic blood pressure is called pulse paradox, pulse pressure, pulse deficit, pulse range. The right answer is pulse pressure. The pulse pressure is the difference between systolic and diastolic blood pressure. If the systolic blood pressure is 120 mmHg and the diastolic blood pressure is 80 mmHg, then the normal value of pulse pressure is 40 mmHg. That means systolic blood pressure minus diastolic blood pressure. That means 120 minus 80 equals to 40 mmHg. Next question is, which artery supplies oxygenated blood to the stomach? A. Carotid artery, B. Celiac artery, C. Gastric artery, D. Cephalic artery. The right answer is C. Gastric artery. And the gastric arteries means right and left gastric arteries giving blood to stomach. So stomach is supplied by gastric arteries.